Hello, everybody. This is Jack Ostroff. This is our 12th podcast, and just want to talk about uh, looking forward. And, there's a sort of thing that I tend to do almost for every visit. I get to see the oncologist every 6 weeks, but our big meeting is after we get CT scans. And one of the questions I always ask is, okay, what's coming down the pipe? What's there? And so I'm going to go backward just a little bit, just to talk to you about the fact that when I started this thing 10 years ago, there was one medication that'd been around for about 10 years. It's called Sutent. Sutent had about a 10% success rate. And, um, it just wasn't that shows you sort of the successes they had or lack of successes they had in developing new medications over the years. But things changed almost within a few years for me in terms of immunotherapies being brought on board. Cabozantinib, which was introduced probably about 5 years into my journey, and then Levantinib came out to the market. I most recently did a blood test. No, it's actually, there's a test that you can do on the tumor itself, an analysis. There's an organization, a company called Tempus, which is in the US, and you can arrange to have your sample of your tumor, assuming you've had an operation, the tumor removed. They keep the tumor on file for analysis, but this company will look at your tumor, analyze it, and mine came back with a bit of a surprise. Apparently, I have something called Van Hippel disease, and Van Hippel disease is something that is supposedly treatable, or the medication they use to treat it is called belzutifan. And that is the medication in the current protocol, as I understand it, after the Levantinib that I'm on currently. They do not want me to switch Levantinib from Levantinib. It's working. We know that works. Stay the course. And I buy into that because based on my experiences, you never know how you're going to react. So, I'm hopeful that one day, when I do have, when Levantinib stops working for me, that belzutifan could be the answer, because it is, designed to deal with Van Hippel disease. If that would be the case, I'd be extremely grateful to get out of jail. But I don't, I think people need to understand it goes well beyond that. This is, the fact that we're talking about my process, which is now over 10 years that I've been on functionally 3 different medications. There's a fourth that's already in the marketplace, but there's more coming. So what I did, and I just want to put things in the context, so let's go through this disclaimer for a moment first, that the content shared on my podcast reflects my personal journey and experience as a cancer patient. I'm not a medical professional. Nothing discussed in this podcast should be considered medical advice. Always consult with your own doctor, qualified healthcare provider, or for guidance related to your health diagnosis or treatment options. Every person's medical situation is unique, and professional advice should be tailored to your individual needs. So here I am 10 years later, and there's a medication I haven't taken that might work for me. The belzutifan results, even for those that don't have Van Hippel disease, are quite good. So, medications for kidney cancer are improving. And I thought, let me just, go through a little exercise. I always like to do a little homework to figure out, what's out there, what's coming. So, for those of you who know ChatGPT, I decided to ask a question, what are the upcoming kidney cancer treatments or new immunotherapies? And this is something you do yourself, and you should understand what's out there, and something that can be discussed with your oncologist during your meetings in terms of what you're using now, what's in the system, and what might be coming down the road. Now, there are emerging approaches that are not mainstream at the moment. They may be in drug trials, but this is from ChatGPT, and these are emerging immunotherapy approaches. There's a novel immunotherapies. Researchers are developing real generation immunotherapies, such as small molecule inhibitors like NDI 1011150, which shows promising anti-tumor activity in patients with advanced kidney disease. NK cell therapy. Clinical trials are exploring the use of cyclokine. I'm out of my league here. Induced memory like CIML, natural killer cells, as a form of immunotherapy. Here's one that we've talked about or we've heard about: cancer vaccines. Advances in AI and better understanding of the immune system are fueling research into cancer vaccines. There's new targeted vaccines, HIF2A inhibitors, PRMT inhibitors, combination therapies, which include nivolumab and targeted therapies like cabozantinib, which is quite interesting to me. Ongoing research targeting new pathways. So researchers are actually looking through new therapeutic targets, especially in clear cell carcinoma. That's what I have, to develop new drugs. AI and genomics. The development of AI and advancements in genomics are accelerating the discovery of new drug targets and personalized treatment approaches. Clinical trials, new treatments are being tested for clinical trials for various types of kidney cancer. So there you have a plethora of possibilities. And I'm sure there's more out there than I've raised. And what that's saying, or what that says to me, is there's hope beyond what you can see today. There's, from my friends in the industry, I know that there are going to be AI advances will come to the marketplace pretty soon. What does that mean? Is it a year, 2 years, 3 years? I don't know, but it's coming. And I think that gives you an element of hope. The medications that we're on today work for a few years, and there's a bunch of them, and that, I'm hoping you'll have 10 years plus, and there is something out there that sort of, kills this cancer, that we have in our bodies. So I'm grateful. I'm grateful for the fact that, the good people at PMH and at Kidney Cancer Canada have been great advisors for me, and the doctors and the nurses at PMH and TGH and North York General have all been wonderful. I mean, I wouldn't be here without them. And I also have to be very appreciative of, I'm very fortunate to have such a supportive family. I mean, Shauna's been through this journey with me every day for 10 years. God bless her. Every day at the hospital, and there she was at 9 a.m. or earlier with my cup of coffee and breakfast sandwich. And she'd be there for most of the day. Carlene Jared by my side all the time. And the support I got from family and friends is just remarkable. I'm very grateful for all of that. Also grateful for the drug companies, the Trillium funding, the government funding. Let's face it. If I had to self-fund this, I think I like most people would be bankrupt. I think there's a cost that across the system have been extraordinary. But I think it speaks volumes to our Canadian system that we pitch in and we help each other. And I'm hoping to raise some money that will help others. I know I've paid my taxes over the year. I know that thankfully Shauna, Carly, and Jared, who pay their taxes, have contributed, but are not taking. And that's how it works. We help those in need. And I think that's, I think that's a remarkable approach. I think it's the best approach. Certainly one that I'm very grateful for. So I'm very thankful to be a Canadian. I'm thankful for the system that has given me life so that I can enjoy my family and inclusive of 2 grandchildren that have arrived, 4 and soon to be 3. That's all I could ask for. I don't need more than that. I'm so grateful for that. I don't know how much time I have. I've asked. I think I stumped them. They don't have an answer for me. The cancer I have is small. It's not. The fight continues, and that's all I can ask: an opportunity to be in the fight. I can't predict the future. I'm hopeful that some magic happens somewhere along the line, not just for me, but for others. I'm one of many here. When I go to the hospital, I go to PMH, as I know many of you do. The rooms are full, whether it's blood tests or pharmacy or, immunotherapy or CT scans, which are happening, seemingly, I don't know if it's 24 hours in a row, but it's a lot of hours because I've been there late in the evening. I've been there early in the morning. It's remarkable, how hard people are working at this and how, the quality of the staff, the professionals, the radiologists, the people doing the scans, the doctors, prescribing medications, the nurses, their knowledge is exceptional. And I would not be here without them. So I'm really grateful for all of their support and your support. And I hope you support others by contributing to the Princess Margaret Cancer Foundation and to the Kidney Cancer Canada. We very much appreciate your support. I'm going to do the best that I can to continue to support this organization. And I am eternally grateful for the support they've given me to allow me more time to enjoy my family, and I'm hoping for more. I wish you well. Work hard at maintaining your health. Be active, be involved. Understand the benefits of a good diet. I can be doing better. Exercise, I can be doing better. I'm doing my best, but I can do better. Listen, we're only here for a short time, and I think you make sure to appreciate your friends and family, especially those that have been so generous in their support. I'm so fortunate with the support I've had from family and friends. I'm very grateful to all of them, and try and have a good attitude about this. This is tough. This is not an easy ride for anybody, but you have a choice. You have a choice. You can be miserable, and you probably have a right to be miserable, but it's not going to help you. So let's focus on things that are going to help you. Change your attitude. Be positive. Work hard. Do your best. We all know where this ends. I mean, for all of us. But if we work at it, there are people that do get out of jail. People that get more time, such as myself. And maybe you're going to be one of those people. But you got to fight for it. And you got to have the right attitude, be involved, be active, eat well, do all the things that you're supposed to do. I don't have to tell you what to do. You already know what to do. but I'm encouraging you to do it because it doesn't work, and this has worked for other people. I hope it works for you. I wish you uh, good health and a long life and the enjoyment of your family and your friends. And take care. I hope this helps. And please contribute to, Princess Margaret Cancer Foundation and Kidney Cancer Foundation. You're really helping yourself. You're helping your family. You're helping your friends, and that's what's paramount. All the best. It's been a pleasure. I'm going to follow this up with podcasts to deal with financial issues. When I got out of the hospital in June of 24, I realized that it was time to refresh my affairs. I thought I was in good standing, and I thought it was, that refreshment meant going back to the financial professionals that I've worked with over the years. And so I want to present podcasts with professionals involved in estate, in taxes, in pensions, in insurance. I want you to benefit and investment strategies, low risk related strategies, because I want to help you understand that we all have responsibilities to our families. And I want you to be aware of the tools that you will need. Do not, one of the things that I've learned, I'm a chartered accountant by trade, but, I don't know everything. I know something about the business that I do, but there's so much that I don't know. And I rely on financial professionals to help me do things right. And if someone such as myself with my education needs the help, for those of you who may not have a financial background, I urge you to get financial help, to get financial professionals to help you, because that will save you so many dollars. It'll be the right course of action for your family and friends, if you if you feel so inclined, to organize your affairs. And I encourage you to watch these, because I'm hoping that you'll learn something, or at least from that, pick up enough information to have interest in talking to financial professionals, because each of us are different. Each of our needs are different, and only a financial professional can address your particular needs. I will present generalities, but I think from top professionals that I've worked with, I hope that helps you. So stay tuned. We have 5 broadcasts on financial issues. Again, thank you for tuning in. I appreciate you very much, and I wish you the best. Good health to everybody.